The government agencies that oversee U.S. airlines are taking a new look at their mental health regulations for pilots after an off-duty Alaska Airlines captain allegedly tried to turn off the engines of a plane in mid-flight. The National Transportation Safety Board convened a mental health forum yesterday to examine what needs to change. Kris Van Cleave is at Washington's Reagan National Airport. Kris, what's going on?
Well, good morning. The witnesses at this forum said they feared reporting problems because they worried about the potential of being grounded for good, essentially left unable to make a living. They told the forum that the FAA rules have created a stigma around mental health that many believe presents a safety risk.
19-year-old student pilot John Hauser was struggling with his mental health in silence for months, fearing seeking help would lead him to losing his FAA medical certification required to fly. He took his own life by crashing this plane in October 2021.
John did not have a known history of depression.
His mother, Ann Sue.
In a letter describing the turmoil that John was silently facing, he wrote, "I want to seek help more than anything. I just know if I try, I will have to give up on aviation. And frankly, I'd rather not be here than to do that."
Disclosing mental health issues can lead to a pilot being grounded by the FAA. United Airlines First Officer Troy Merritt grounded himself a year ago to get treatment for anxiety and depression. He says he's taking an approved FAA medication, but it could take another year out of work before regulators allow him to fly again.
Had the barriers that are in place today not been there, I know I would have sought treatment earlier.
One study found more than 56% of U.S. pilots avoid seeking medical treatment out of fear of losing their FAA certification to fly.
We got the message loud and clear from all sides. If you want to fly, you can't admit anything is wrong.
Court documents say off-duty Alaska Airlines captain Joseph Emerson allegedly took psychedelic mushrooms 48 hours before he attempted to turn off the engines of an airliner in mid-flight, reportedly telling police he'd been battling undiagnosed depression. He's expected to be arraigned today on dozens of charges, including 83 counts of reckless endangerment.
Choosing between lying and flying without seeking help, that's not a choice.
Following that October incident, the NTSB called this first-of-its-kind mental health forum. Board Chair Jennifer Homendy.
It sounds like from where you sit as the chair of the NTSB, the existing regulations aren't good enough.
The existing rules are arcane. At the very least, pilots and others need to be able to sit down, talk to a therapist, and not worry about the impact on their jobs.
The FAA says it does provide a pathway for pilots to return to the cockpit, but ahead of the forum, the agency announced a panel to review existing mental health regulations. FAA Administrator Michael Whitaker.
We need to have a system that allows people to be more forthcoming and to have treatment for issues that shouldn't keep you out of the cockpit.
Now, the FAA has conducted similar reviews in the past that didn't yield much change. A 2016 survey study from Harvard, so this is pre-pandemic, found about 1 in 8 pilots could qualify as clinically depressed. This morning, the nation's largest pilot union is joining the call for change, saying the current system is outdated. Nate?
Seems like it's time for an update. Kris, thank you.